Hi everyone, welcome again to another episode of the Health Tech News brought to you by Medics in Tech. Today, I'm going to be sharing major highlights, events, activities that happened in the health tech industry in the month of June. So stay tuned and I will be right back. Welcome back. First on the news today is a major update from Zambia. Zambia launches AI-driven remote health pilot with Finnish support. Zambia Ministry of Science and Technology, in partnership with the Ministry of Health, 73 Health Global and Pentatech Limited, has launched a nationwide pilot to test remote diagnostic tools and AI-based pharmacological analysis across all 10 provinces. This initiative, backed up by the Finland government and Starlink distributor Paratus Zambia, will deploy remote health technology developed by Finland's 73 Health Global and Zambia's LaryRx AI, a homegrown tool for analyzing drugs interaction and improving patient safety. This pilot will run in 20 health posts nationwide. At a press briefing, 73 Health Board Chair Jaakko Seppälä said the company's mission is to make healthcare more accessible and affordable through AI and telemedicine. Patients in remote and underserved communities will be able to receive timely, high-quality care without the need for in-person consultations. Also, the Finnish ambassador to Zambia, Sanna Alinen, made a comment about this innovation. She praised the long-standing cooperation between the two nations, emphasizing Finland's global reputation in digital innovation and its commitment to development partnerships in Africa. So I'm excited about this innovation for Zambia and the fact that African countries are really intentional about health technology, and they're making strides to ensuring that their country becomes a center of attraction for health innovations. This is really super commendable. So well done to Zambia. All right, let's move on to the next update. Next on the news, UK government slashes red tape to unleash life-saving innovation. Patients and healthcare providers in UK are set to benefit from a new era in cancer treatment as the UK government slashes red tape to unleash life-saving innovation. Now, the major highlight from this news update is that NHS patients will be the first in Europe to benefit from a groundbreaking non-invasive liver cancer treatment. The major highlight of this news is that there is a new liver cancer treatment called Histotripsy, developed by a US-based company called Histosonics. This device uses ultrasound technology and is used to destroy tumors without surgery, scalpel radiation, with minimal damage to surrounding organs. Of course, the major concern with cancer treatment is the damage to surrounding organs. So if we have innovations that can solve this issue or reduce it to a reasonable degree, then it's something that is highly welcome. So I'm excited about this innovation. Let's take more updates about this news. With these innovations, patients stand to benefit from faster recovery times, potentially higher survival rates, fewer potentially dangerous complications, and shorter hospital stays. And I believe that you agree with that. Another exciting thing is that there's an ongoing research to explore the potential of this new cancer treatment to transform other hard-to-reach tumors like tumor of the pancreas and kidney. And that's not all. This treatment can be performed in less than 30 minutes. And of course, it is non-invasive. So it causes limited or no pain, and it can be delivered within a short session. So patients are guaranteed of a quick recovery time. This technology was procured and installed due to a generous donation from the Li Ka-shing Foundation to the University of Cambridge. According to the chief executive of the Cambridge University Hospitals, Histotripsy is an exciting new technology that will make huge difference to patients. By offering this non-invasive, more targeted treatment, we can care for more people as outpatients and free up time for surgeons to treat more complex cases. And I totally agree with everything said in these news updates. So we have non-invasive treatment for cancer that takes less than 30 minutes and causes limited pain or no pain at all to patients, then it is highly welcome. And I hope to see more progress in the treatment of cancer. Okay, let's move on to the next update. Next on the news, new startup Insight Health built AI for routine clinical tasks. Insight Health has built a patient-facing artificial intelligence agents to handle routine clinical tasks for medical practices, from intake to managing patient histories and follow-up. Well, their innovations recently developed to solve a similar problem. So what makes this innovative solution by Insight Health to be important? According to the CEO of Insight Health, Jamai Soni, there is a growing list of AI startups focused on automating medical documentation, but those tools just focus on faster note-taking to collect information during patient visits. Now you know why I said there are innovations that are similar to these that were developed recently. According to Jamai, after talking to hundreds of physicians and hundreds of providers more generally, a key pain point for them is really the amount of routine time that they experience, and a lot of that is really on the patient-facing side. All right, so we're getting closer to why they decided to launch this artificial intelligence model. Let's get to know the ending parts of the story. One of the key motivations for us is, how do we offload the incredible amounts of routine clinical work to AI in a safe and trustworthy way to allow providers to see more patients and allow them to work at the top of their license? What we built is a virtual care system that can meet independently with patients, starting from a screening or referral screening, Sony said. All right, let me help you make this more simpler. Let's say a patient has an appointment with a doctor in the next 2 weeks. Within this time frame, the patient will be able to interact with an AI tool that will take information of the patient, from the history of the patient to the background to their clinical symptoms. Anything the patient would have told the doctor about themselves will be taken by this AI. So when the patient gets to meet the doctor in 2 weeks' time, this information are already there on their database. They just have to go through it, and they will only have to ask further questions for where they need clarity. So this reduces the time that the patient will have to spend with the doctor, and rather than spending 30 minutes explaining themselves from the beginning, they can just spend 3 to 5 minutes. So this is really making sense. Any innovation that reduces the time that clinicians have to spend with patients so that they can focus more on the treatments, on research, and be able to do more things that can help patients get better, that is really exciting and welcome. So yes, this innovative solution is important, and now you know why. That is all from Insight Health. Let's move on to the last update for today. VitaHub has acquired digital software company called Induction Healthcare. UK-based health tech company VitaHub has announced the acquisition of digital software company called Induction Healthcare. Let's get to know more about what this acquisition is set to deliver to the world of health tech. The announcement details the supplier's focus on enhancing the patient journey from hospital to home across the UK and beyond, with Induction Healthcare's patient platforms, Zesty and Attend Anyway, playing a pivotal role in modernizing care delivery and patient engagement. Just in case you missed it, Induction Healthcare has 2 major platforms. The first is Zesty, and the second is Attend Anyway. Interesting. What comes to mind when you hear Attend Anyway? Let's get to it. Zesty reportedly provides patients with seamless appointment management, digital consultations, pre-visit questionnaires, video consultations, and more. While Attend Anyway helps to turn video consultations into a routine part of care delivery. The use of this platform was made as a statement by the company during the announcement of the acquisition. I find these platforms quite interesting already. Let's get to more updates. Speaking on the acquisition, Mike Sanders, the CEO of VitaHub UK, said, "We are excited to welcome Induction Healthcare into the VitaHub family. Their solutions are highly regarded across the NHS and directly aligned with our mission to enable better connected, more efficient healthcare. Together, we are enhancing the digital patient journey from hospital to home, ensuring a seamless experience for both providers and patients. So, with all of these innovations that ensure that healthcare is brought closer to patients at the comfort of their home while reducing the time that healthcare practitioners spend with patients to ensure they have more time to do research, to spend on developing treatment, and other things that will move the healthcare forward at a speedy rate. These innovations are exciting and very much welcome. And that's it for June Roundup. I hope these updates are interesting to you as much as they are to me. And if you're passionate about healthcare, you should do well to subscribe to this channel, turn on your notifications to ensure you don't miss out on any updates. And I would love you to listen to the next episode coming your way in July. Thank you for listening. My name is Glory Ayobami, and I'm excited again and again to be your anchor for these news updates. Till the next time, fire.